All right, welcome back. This is Dr. Stokes with Bread and Butter Primary Care, and this video is about the assessment and plan, the end all of what we're trying to accomplish. And so as you're going through your medical training and your preceptorships, by the time you finish with those years of training, the hope is that you'll be able to form an assessment and plan for a wide variety of primary care subjects. And that's how you know you're getting ready to go out and to be able to treat people and help them with their health. And so the assessment and plan, the assessment is a description of what you think is going on, and the plan is what you're going to do. And so the assessment and plan is important for several reasons. One is it's actually what the patient's going to be told to do about what's going on. Two, it's also where other providers are going to look to find out what is going on and what they need to do. So specialist providers, other providers who are your colleagues and coworkers, they're also going to be needing that information. And another one is for you for future use. A lot of times people don't realize that when you go to the doctor and you see them, you're one of 20 people for that day. I see around 20 people a day, and I work 4 days a week, and so that's 80 people a week. And so, after a month or so of that, if I don't have good information in my note as far as what I was thinking and what was going on, it can sometimes be very difficult to see a person for follow-up and remember exactly what we talked about. So having a good note, having a good, and especially the assessment and plan, because when I write my note, my goal is that if anyone needs to know what is going on with that patient, what the next step were, what I was thinking, the only thing they have to look at is the assessment and plan. The history and everything else is there. They can go through that as well. But hopefully the assessment plan is a synopsis of the entire thing, so that with just that information, you're going to be doing pretty good. And so let's talk about the assessment first. So the assessment is a good description, logical, sequential description of what you think is going on, why you think it, and then kind of why it leads to the plan. Whereas the plan is what you're actually going to do. So I'm going to give you an example, kind of a straightforward example for bread and butter primary care. Let's say you're seeing an 8-year-old patient who has a sore throat, okay? And so you've gotten the history and everything, and you're wondering, is this strep throat? Is this a viral infection? Is this like a laryngitis from screaming all night at a football game, or whatever the case may be? And so you've gone through your history. The assessment is where you can briefly describe exactly what it is you're thinking. So let's say on this patient, you found that they had had a sore throat for 3 or 4 days. They initially had a fever. Their sibling had also had a sore throat a few days before, and on exam, there were large lymph nodes and a lot of redness on the throat. You did a strep swab and it was negative, okay? So my assessment would say something like this. 8-year-old patient coming in for throat pain, most likely strep pharyngitis, given the fact that it's been several days with a sore throat, known exposure, large lymph nodes, and a red swollen throat. Strep swab was actually negative today, but given the positive exam findings and significant history, still most likely strep. And then the plan would say, well, what are you going to do? And so my plan would say, send strep swab for culture, initiate treatment with amoxicillin. If culture comes back negative, would call the patient to pause treatment. Okay, so there you go. In that one paragraph, if I'm out of the office the next day and someone else is coming in and they get the message back that, hey, this kid's strep culture was negative, and they're thinking, okay, what do I do with that? They can open my note just with the assessment and plan. They know a little bit about what the history was. They know a little bit about what the exam findings were. They know what my thinking was. That my thinking was exam looks like strep, the history sounds like strep, the swab was negative, but I'm suspicious it is, so I'm going to start treatment. We'll stop if we need to. And so they can get that culture back and they know what to do, okay? So maybe the same patient, but maybe a little bit different story. Maybe they don't have swollen lymph nodes. Maybe their throat doesn't look red. Then the assessment might read something to the effect of 8-year-old patient coming in with a sore throat. On exam, there's no redness in the throat. The lymph nodes are normal. There's some mucus drainage. Most likely a viral infection. Strep swab was negative. I'm going to send that swab. And so then the plan would say, send the swab for culture. If returns positive, would initiate treatment with amoxicillin. If culture is negative, continue conservative care for 7 to 10 days, follow up if worsening. There it is, right there. And so again, someone is sitting in the office the next day because I'm not there, and they get this strep culture and they want to know what to do. All they have to do is read the assessment and plan. So the assessment, a summary of what you were thinking. What did you find? What did you think? What was your differential, and why did you pick what you picked? Plan, what are you going to do? What medicines did you send in? What instructions did you give to the patient? And then one thing that I like to have in my plans is, what will you do if there's pending results? So very frequently when you finish a patient, especially in an outpatient care setting, there's things you're waiting for, so people come back and they feel really tired and fatigued. And so maybe you ordered a lab panel to check, make sure they're not anemic, and to check, make sure they don't have a low thyroid. You're waiting for that. And so your note might say, patients here, the assessment, patient here with complaints of month-long fatigue with these other symptoms, possibly thyroid versus anemia versus depression. Plan, will draw CBC, CMP, TSH today. If TSH is low, would initiate thyroid replacement. If all labs are normal, would follow up in 2 weeks to discuss with patient. And so they have a, here's what's outstanding. Depending what those results will be, here's what I would do. So then if you get those messages back, you can simply review that one paragraph and you know where you're at. If someone else is seeing that patient, they also have that information. And so a good, concise assessment, summary of what history you got, what you saw, what your differential was, and what you decided. Assessment. Plan, what did you do, and what would you do if there's any pending labs or pending things coming back in. All right, so there's your assessment and plan. It's the cream of the crop. It's kind of the cherry on top. It's what you're working to develop over the years of preceptorship, and it's one of the things that more and more experience seeing things, it comes quicker and easier as time goes on. And so I hope you guys are having a great day. I'm looking forward to a weekend, and I'll be seeing you later.